So thank you for joining me today. I do want to talk about private health insurance and healthcare costs in Australia in this talk, giving you a basic idea of what insurance is, what health insurance is, what private health insurance is, and how it relates to healthcare costs, and whether it reduces or increases the healthcare costs we face when seeking care. But before I begin, I would like to acknowledge the traditional custodians of the land on which Macquarie University stands, the Wallumattagal clan of the Darug Nation, whose cultures and customs have nurtured and continue to nurture this land since time immemorial. I pay my respects to elders past and present. So I first do want to start by giving a little bit of an explanation what health insurance is, and maybe before I explain what health insurance is, maybe let's first consider what insurance more generally is. So that can be any type of insurance, can be health insurance, can be your car insurance, can be your home content insurance, or life insurance. So the basic idea behind insurance is that we face uncertainty about having to pay for a specific service in case we face an adverse event. We do not know if that adverse event will occur and if we will need that financial support. We do not know when it will occur, and we also do not know how much of the payment will be required if we need it. Insurance will allow us to reduce the financial risk from that adverse event. So we'll still experience that. It will still not be desirable or nice, but kind of the financial shock from that will be covered by insurance, and we will pay premiums into a pool, and the pool will then cover the costs when the adverse event occurs. Now, adverse event, what does that mean, and how can we apply that to health insurance? So adverse event in case of health insurance just means being sick or getting ill, and we do not know if and when we may be affected, so if or when we may get ill, or what specific illness we will have. And we can usually seek treatment for the illness that we experience, but that treatment costs money, and then that cost will depend on the illness, and insurance can cover us for that. And so that is the basic idea, from an economist point of view at least, what health insurance is. Now, what type of health insurance is there? So health insurance can be public and it can be private. Sometimes, funnily, it doesn't even have to be called insurance. So, for example, the pre-provision of community or hospital services is a form of insurance. Because if you remember back to my previous slide, it covers the cost from an adverse event by reducing the kind of financial risk that we as individuals are exposed to. Now, in Australia, there are several public and private health insurances that we have. So the main public health insurances that are available for Australians and and permanent residents are Medicare and free provision of services in state-run hospitals and clinics. So again, you may have thought that health insurance will only be Medicare, but it's actually also the existence of public hospitals and public clinics that provide services for free that actually also fulfills the role of an insurance. And then, in addition to those public insurances, we also have private health insurance for Australians and permanent residents. And so those can be for treatment as a private patient using hospital care, or for treatment as a private patient using so-called auxiliary services. So those are like physiotherapy, some psychological care, going to the dentist, vision correction, and others. And then there's another type of care, which is private health insurance for temporary residents. So we often do not think about that, but some people in Australia are actually neither covered by private insurance nor by the classical private health insurance and by public health insurance, and then typically they do source some private health insurance as long as they live here. Now, if you know that health insurance should cover the financial costs of an adverse health event, why does insurance not cover all the costs? So that's an important topic that we study if we study insurance as health economists, and the reason for that is that there's so-called moral hazard. What is moral hazard? Moral hazard means that the use of healthcare services will increase when an individual has insurance, and that possibly leads to overutilization of care. So people use more care than they actually need, or they become more likely to use care. So kind of they may have been what could be considered as reckless with their health, because they do know that if there's a financial cost resulting from that, they do not have to cover that. Now, there's nothing really, although it's called moral hazard, it's nothing too moral really about it. It's just the consequence of the cost of healthcare utilization being lower when individuals have insurance. Now, overutilization of services has two consequences. First, it increases the cost to the insurance, and because the insurance has to cover its costs some way as well, it will increase the price of getting an insurance. So kind of, if we are engaged in a moral hazard, it will make kind of the whole healthcare coverage more expensive. The second issue with overutilization is that service use will be skewed towards individuals with insurance and away from individuals who need the services. So those people who have insurance are not necessarily the people who need care the most, but they will be more likely to seek insurance relative to people who actually really need the insurance. So that's why kind of this type of skew, this is why moral hazard isn't really desirable. Now, it is important to notice that overutilization of care due to moral hazard can be demanded both by patients who kind of like go to the doctor and ask for more and more care, or it can be induced by practitioners. So it is not necessarily the patients who are overutilizing, but they may be in a system of care where the providers of care kind of know that they have insurance and then encourage them to use more services. And now, how can we reduce moral hazards? So usually insurers do want to reduce moral hazards, and they do so by including co-payments together with insurance plans. So this makes utilization of healthcare not cost-free, and then in turn reducing the overuse of services. And so for one example for that is actually if you look at Medicare, Medicare is quite designed to limit moral hazard, and so they are, for that reason, they are, if there's a lot of use, there's a lot of co-payment, usually through so-called gap payments. And in fact, under Medicare, individuals are not allowed to insure against the gap payments, so they cannot seek some sort of other insurance which then induces moral hazard. So Medicare has kind of safeguarded itself against some kinds of moral hazard. And so similarly, private health insurance also often includes co-payments. Now, my final question for this short presentation is, why should you get, or should anyone get, private health insurance? And this is actually a fairly difficult question, so I start with a note saying that the reasons for why individuals get private health insurance is actually not very well understood by researchers. It's not that we have no understanding, but we don't really perfectly know why people get it. Reasons also may differ quite strongly between whether people get hospital care and whether they get auxiliary care. So auxiliary insurance covers care that is actually not covered at all by public health insurance. It's usually not for really life and death type costs. So for that reason, and the kind of exposure to financial risk is not as big as in hospital insurance. But if you don't have private health insurance for auxiliary care, you're actually not covered at all. You have to cover all the costs yourself. So that can be a reason for people to get this type of care. Now, it's different for hospital care, because hospital care covers care that is actually already available without any user charges in the public system. However, private health insurance will allow people to get care that comes with greater choice, and particularly choice of the doctor that they will be treated by. It may allow them to seek more timely care, so they do not have to go on a wait list. And usually care is delivered with better amenities. So this is kind of a better convenience of care, if you want, in some ways. But that, of course, can be desirable for many people who are seeking this care. And also, I started out with outlining that private health insurance is meant to reduce the financial shock or the financial exposure to costs. Now, will private health insurance in Australia reduce the healthcare costs for individuals? Now, I think the answer is that it's unlikely that it will do so, because it increases the cost for patients because they will have to pay for premiums, and they will also have to typically pay for co-payments. It can reduce the cost for those who get ill and are determined to get private hospital care. So that, for example, if a person thinks that they really need the features that only private health insurance can offer, such as choice of doctor, better amenities, or shorter waiting times, then eventually for that person the cost will be lower if they have private health insurance. However, if they do not necessarily want this type of care, then private health insurance cannot really reduce their exposure to the financial shock from getting ill. So that's it from me, and this is a summary of me, the presenter. Thank you very much.